I'm Dr. Angela Mazza, a thyroid, endocrine, and metabolism specialist with an integrated practice in Central Florida. As our listeners know, my goal for this podcast is to define and demystify the thyroid gland and thyroid-related medical conditions. By providing information in easy to understand format, I hope to help patients better understand the ways in which their bodies work and to help them thrive. My friend and co-host, Dawn Sheffield, is here for this episode.
I'm just delighted to be included because I wanted so much to meet our very special guest today. I have heard so much about her, all of it positive, and I know she's very special because she's so close to your heart and to the heart of your family. So I feel like I already know her.
Oh, well, she definitely is very special, and we're friends, very good friends. I'm glad she's here today. So, listeners, our guest name is Tina Randolph, and she's the lead caregiver for Griswold Home Health Services.
Welcome, Tina. Glad you're here.
Thank you. Thank you for having me.
I understand you've had a recent promotion. What are your primary responsibilities?
Well, as of now, I'm the lead caregiver, as I said, well, you guys introduced me as. I help out in the field where someone may call out from work. I fill in that spot. We may have a new client. They might need help in trying to transition into having someone in their home. I might help to train someone. I might go to a facility to be with someone that might be on vacation. So I do a fill-ins. I'm also in the office helping out, doing some administrative work as well as I'm training this new position. So yeah, it's a new position, new spot for me, and trying to get used to it.
Very cool. And our questions are going to focus more on the work you were doing when we met. So our listeners
Okay.
can learn about in-home care and assistance, and we'll also talk about some of your, like we kind of mentioned what your new responsibilities are. I kind of want to give a little bit of a backstory. So for our listeners, how I got to meet Tina.
Okay.
My mom was in hospice for about a year and a half. She had progressive dementia, and it was a pretty tough time. And my dad and I went back and forth as far as bringing some help in. Then my mom went to the hospital. She ended up at home, and one of the amazing home health aides that came to help us, and who was a godsend, was Tina.
Mhm.
And my dad and I came to really kind of depend upon her. She was not only helpful in caring for my mother, but she was a huge help for my dad. And we've had multiple like near close emergencies that we
Yeah.
tried to manage across the states.
Mhm.
But that's how Tina and I know each other.
Mhm.
So, like I said, we're going to dive into some questions. I do have to say that we always talk about stress and cortisol on this podcast. So there's
Okay.
good stress and there's bad stress. I have to say, and I think Tina, you'd agree, one of the toughest stresses there are is being a caregiver, because it's a 24/7 thing, and someone in your role is really kind of an angel to help out with dealing with that type of stress, because it is very stressful being a caregiver. So I want to
Mhm.
give you some numbers before we talk as well. So just as far as according to the US Census Bureau, the number of people aged 65 and older is up to 71 million in 2019 from 41 million in 2011. So it's
Wow.
mainly the baby boomers. So the baby
Oh,
boomers are
wow.
the folks that were born between 1946 and 1964. So they
Mhm.
make up about 40% of our population. So
Wow.
these are the folks that went into retirement to kind of enjoy their lives at home. And now they're getting to the point where they need
Mhm.
help at home. And
Mhm.
never before have we had to think about the need for home health as much as we do now. Because what I read, and I don't know if you've read these numbers, they're about, we need about we have about 2.6 million home care workers, and another million
Mhm.
are going to be needed by 2030 as more baby boomers age. So this is a serious kind of issue we have to talk about.
Mhm.
So that kind of sets the tone. So
Well, that's really meaningful information because I I think that was helpful actually to see just number one, how valuable and necessary in-home caregivers are and will be in the future. I really had no idea
yeah.
about those numbers.
So
Mhm.
now, Tina, did you like have an experience in your life that led you to this type of service, like a family, friends, or someone inspire you down this path?
Yeah, I was inspired by my great grandmother, Reverend, let's say Dr. Reverend Margaret L. Wortham, who is from Chester, Pennsylvania. I was inspired by her. So as a little girl, I watched her help the community of Chester. So she not only was, let's say, a pillar to the community of Chester, but she enrolled or was the first graduating class in Chester Crocher Hospital, where she was the first graduating nursing class. So at that
Wow.
hospital, if you go there, you'll see that first graduating class. She is in that picture. So, like I said, I watched her. I've heard many stories about her, things that she has done. And just watching her, I felt like I could do the same thing that she could do. Like, I'm like, I can do what my grandma did, So a lot of things we went around with her and saw her give food, just different things that she did. We just kind of went along for it. It wasn't, well, do you want to go? It was like, you're going. We were made to go to some of these things with her. So it wasn't where I had a permission or to ask if I wanted to go. So we were made to go. So as me being made to go, that made me want to be a part of what she has done for the community of Chester. So inspired by my great grandmom. So but what I do is because of her.
Oh, that's wonderful.
Wow. Well, Tina, what type of patients did you and do you still really care for? Is there a age bracket in general or any generalities that you can see?
It's not an age bracket. I find myself, I've worked with, elderly. Well, I've done that for years. Also recently, not too long ago, I've worked with my great grandmother's sister who is 99 years old.
Wow.
She's at home, in her own home. And so I was taking care of her while I was taking care of Dr. Angela's mother. 3 days out of the week at night, I stayed overnight at her house. So I was doing that as well, taking care of a family member, where all family members were trying to get part of the schedule to rotate. So I worked two jobs.
Days and nights.
I heard. Wow. I keep saying wow because
She's
it's amazing. Yes.
So, Tina, is there something that would surprise people about your work with patients and their families?
Well, I would say one thing that was surprising, it's something that I'm able to get them to do that they might have been trying to do for a long time. And they're like, well, how come they do, doing it for you and not for me? So sometimes it works where somebody else may have to try a different way or technique, getting someone to do something that they couldn't do. And they might have been frustrated about it, or it just didn't work. But for me, I find that when someone can't do, I'm able to come in and try to help them to get the job done. So
you have that calming presence that makes them want to do it.
Yes.
mm-hmm.
And it's great that you just said that because I have just had a recent experience in my family, and what you just said about you coming in and doing something, and wow, it's very true. And you do have a way and a presence about you. I can see why you're very successful at that.
I feel that's my gift, my calling.
It definitely.
Yeah.
Is there a big mistake, Tina, that you think people make, families maybe, when they're hiring a caregiver? And one thing that occurred to me was maybe they don't do it soon enough. I don't know. What's your opinion on that?
Well, I try not to force anybody to do something they don't want to do, and just let's say give it some time. But we can't get it on today. Let's maybe try tomorrow. See how they may be feeling, what's going on. Because I try to put myself in their shoes. How would I feel if I can't do something I used to do? I try to put myself, in their shoes to, be sympathetic to where let me just go at their pace and then see where they may open up to doing something or not doing something, to where a family saying, well, I'm paying you to do this job, so you better do it. So my thing is, let's all work together so we all can get the job done. So we all on one page, it will work. If we all work together to help that one person to do whatever it is, because with them losing what they can't used to do or walk or talk or feed themselves, they may feel embarrassed or feel some kind of way that they're not able to do, and I'm wondering why they can't do it. So I try to go at a certain pace with them and just take baby steps and not even push a person to make them do something that they used to do or whatever. But I don't know what's going on inside their head. Yeah, so I try to figure, what could be going on inside of their head and their mind and body. So just be sensitive to what's going on to help them get through the process of a change that has taken place in their lives.
And I think sometimes it's hard too for families to recognize that the patient can't possibly do things as well or at all that they used to do. And I think you'd be very helpful in that situation.
Right.
Yeah. And I mentioned that, my mom was on hospice. Is it pretty common is it common for you to work alongside with hospice patients or the hospice staff?
I have worked in certain areas with hospice, knowing what they're saying, what the next steps is going to take place. So I am used to, I've had experience working with hospice and with hospice, the hospice people that you have for your mother as well, we all work together as a team. So everyone worked together in order to make things happen, to make sure you was, at peace on who was there in your home and taking care of your mother. Um, we just all was one team working together. So it all worked out.
Right.
Well, Tina, in your experience, do you find that most families have very little idea? This is part of what I've just experienced. It's so strange that we're doing this episode today because we had a big situation in our family just this past week. So do you think most families have any idea in the beginning just how incredibly hard it would be for them, both emotionally and physically, to care for an ailing person in the home, especially if they have no support, if the patient is unable to assist in their own care, maybe the patient's combative or very, very ill? Do you think at first, when you first come on the job, most people are greatly relieved to have the support they might not have realized that they needed?
I would say for most cases, yes, that they find that they're relieved that someone's able to come in. And that way when we're coming in, or say for myself, I kind of give them a little help or a little teaching or training on what's taking place, what's going on, so they can kind of get an understanding, because with the change in their life, they may not understand what's going on and how can they help, or why, in this stage of life that this is what's going on, and that the person can't do, what they used to do, and like they just don't understand. So try to give them an understanding of where that person is in their life at this time, and how we got to work together in order to make it comfortable for them. And so it won't be, strange as well for the client as well, or the patient. So we try to I try to come in and just make them feel comfortable and say, this is where we're at, and this is what we may need to do in order to make it work for you and for the client/patient.
Right, right. So it's kind of like a little bit of a respite care. So for the
Yeah,
time for caregivers to get their own needs met. So that's probably just as important as the patient themselves, correct? Or
right, right.
okay. So your work must be some of the most emotionally challenging in the world, I can imagine. When you're on the
Yeah.
job, how do you not only do the important work, but still bring peace in difficult situations? You kind of alluded to that, but it's got to be tough.
Yeah, I try not to take it personal, because like I said, I treat these people as if they were my family members. If I were, taking care of my own blood. So I try not to take it personal, because I'm there again. I'm here to help them, for them to get through the process of it all. So I try not to take it personal and make sure that, at the end of the case, or that situation, that their needs was being met for their loved one. So I try not to take it personal, even though you can't, I have had times where I had to let it not make it personal, but when it's later
Right.
on, like a woosah, or I can put it, let shed a tear or something, to where I did feel something, but I had to hold off, so that that family member that's going through, that I got to be there for them. Somebody has to be standing up. Everybody can't be down, so we just kind of stay lifted up for that person so they can get through the process.
Right.
When families do resist getting help in the home, and maybe not in the home, maybe they resist getting help at a facility where their loved one might be, but if they do resist getting that for a while, I think there's probably many reasons. Cost might be one, or I have heard sometimes family members feel they have to sacrifice themselves for the care of and sacrifice themselves entirely. Or the patient sometimes may demand that no strangers come in the house. Do you just encounter all kinds of reasons that people delay getting help, or are there some common ones that you hear a lot?
Um, the common reasons of one, I think, let's see, number one is money. That could be
Yep.
the number one for that one. And then number two, someone's coming to their home, there's just a stranger to them, or you're touching them, just different things to where why they wouldn't want to, or somebody may feel embarrassed to where they might say, well, I can take care of my family member, I can do this, I can do that. And then not so they can't, they really do need the help, and might just feel embarrassed. So their pride. So, those things are presented to where the reason why they may not, are brought into people and do need the help, actually really need the help. And this is my saying, that one day we all may, get hurt, something happen to us. You got to get old one day. You got to need somebody to help you. You need some help.
Right.
That's right. Dr. Mazza and I were talking just for a minute before meeting you today, and one of the things that we think may happen too is as a family member or friend who's a caregiver gets more and more involved in the situation, it becomes, I think, maybe more difficult to really see what next steps might be, or they may get burnt out so much themselves that it becomes difficult for them to even ask for help. Is that something you
Mhm.
may find?
Yeah, I've had that one where a client, their I don't want to say their loved one was really having a bad night while I was there, and then they were getting overwhelmed by it, and then kind of was trying to bring me into being overwhelmed with them, and so I kind of had to pull the um the client's daughter to the side and say, listen, let me try something, but I might need you to step out for a minute so we can see how me and this person can work it out. And then if there's a problem, I will maybe bring you back in. But right now, let me see if we can kind of do a one-on-one. I said, because with both of you guys both being overwhelmed, we're kind of on a high right now. We're not getting anywhere.
Yeah.
So we got
Right.
to kind of work together. So I kind of like say, can we just try this and see what happens? So like I said, everybody got to be on the same page, got to be on the same page in order for it to work. And so I did have where I had to ask one person if they could just kind of step out for a minute, and then I would get back to them, find out what the outcome was, how we, try to make it better, or if there was a change. And in those cases, I've had where there was a great outcome it just turned around, did a 365, and they're like, oh wow. So I brought them back in, and we went from there, like, what did you do? And I'm like, I don't even know what I did, but however, it worked out. We got it
It
done.
worked.
So I just needed them to step out for a minute so we can kind of diffuse the situation, or but it's just want to kind of make sure that person's at peace and that they feel safe, in their home with that change going on, with me being a stranger in their home.
Exactly. Well, I mean, again, on the emotional toll that, as yourself and your job has on you, how do you relax? I mean, well, like, what gives you peace in your downtime when you're not on
Mhm.
duty? Like, recharge your own batteries.
Mhm. Well, I try to schedule once a month to get a pedicure for my feet because I'm constantly on my feet. So I try to schedule a pedicure, and I go out with my girls, and now we kind of they get their nails done, I get my feet done.
All
Um,
right.
Kind of don't do nothing, stay at home, turn off the lights, just be lazy and just relax. Don't answer the phone, just shut down, turn off.
I
You
love
know?
it. Little self-care.
Yes.
That's great. And Tina, I just wanted to go back real quick to something you said in the previous question, which was about, here you are a stranger at first in their home, you become family, but at first you may be a stranger. And my thinking about that is that as a stranger, the real benefit of that is that you really cut through the clouds of emotion. You being not so involved emotionally gives you a clarity that the rest of us may not have. So that in itself is a gift.
Yes. Yep. Just trying to take it personal. You take it personally, you won't be able to do the job. You're just gonna like, yeah, because you're sucked in after that. So just kind of not to take it personal, but you're there to help. You're there to help. We're here to help them to get through the process.
Are there like certain qualifications that, folks should look for in a caregiver? I mean,
Um, well, I want to say first of all, if you feel that you know what you're doing, this is what you're called to do. You like it, what you do. You like being around people, talking to people, caring for people. That should be number one. If it's just where you're saying, I'm just trying to get a paycheck, I'm just trying to get some cash, or get overflow my pocket. That's not the way to go. I would say this is something you have to like to do.
right.
This has to be your passion, that you
Yeah.
like working with people. So for me, I like to see where I've made a difference. So I do evaluation on myself every day to say, did I help somebody on today? Did I make
Love
a
that.
difference? Did someone smile? Did something happen for today where I was a part of that? And that's what my thing is, to make sure I'm a part of something of a difference in someone's life.
Oh,
That's beautiful. Tina, I know that you're with an agency, and I'm just curious about if agencies in general, um, do they help? I assume they help the family to determine what type of care is needed, what level of care, but also to verify that the person they're going to send is qualified to do that.
But we try to match up but like the person's personality with the person, because we do like a background check for as the person's personality with both the client and the worker, and
Now
kind of
that
see.
I did not guess. That's
Yeah,
interesting.
we try. Yeah, so if a person that's like to talk, or a person that might be a shopper, we might put somebody that we know that like they like to shop, so they go out there shopping with that client,
I am so
so
glad I asked. I really assumed that what the answer would be, but I wanted to ask it for our listeners. And then you brought a whole different dimension to it, which I never would have guessed. And please send a shopper. Yeah. Well, sign up for shopper. How about you?
There you go.
Yeah, there you go.
So Tina, what training and education is required for people wanting to provide this type of service?
For training, a lot some are certified, and some have done experience through taking care of loved ones.
Okay.
Yeah, so basically some experiences of being in someone's home or in a nurse's facility or a hospital.
Some
So
real
yeah,
life
some
experience too
some real
counts.
yeah
I think that's what
yes
counts the most, really. You can't train
yes
someone to if they can't do it. I mean, you have, like you
yeah
said, you have to want to do it. It has to be a calling.
yes
And I think you said at the beginning, Tina, that you're at your agency, for example, you do visit patients who reside in various facilities. They don't have to be in the home.
right
Is that correct?
correct.
Okay, good. Because, I think that's something that many times we might not think about. I had not really given that any thought, but again, with the events of this past week, I thought, wow, it would be nice to ensure, in addition to our coverage of of the situation, that we could have someone else coming into kind of, another set of eyes. So I appreciate that. That's really helpful
Mhm.
information.
I know you mentioned you're still working directly with patients,
Mhm.
but I understand you are going back to school as well.
Yes, I'm supposed to be going back September 23rd.
That's
Wow.
exciting.
3 days out of the week at night.
And 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 what are you training for?
I'm training to get my certification again as a certified nurse assistant. I had it years ago, and I kind of let it go at the time. I was trying to have a baby, and so therefore, I had the
Yeah.
baby. She's 15 now, but that was some time ago. But I'm going back to get it because I had let that go. So in order to have my miracle baby, she's here. She's 15 now. She's in high school, first year high school. So she's in high school, and I'll be trying to go back to the college to get that CNA license. Yes.
That's awesome. So you're still really going to be working two jobs.
Basically, well, the mother job that never goes away. That never goes away. So basically, all this I've been doing around her schedule, and so I have a little bit more leeway time to do what it's my time now to do what I want to do.
And you can it's never too late to just keep learning for sure.
Congratulations.
Yeah.
Now, Tina, is there anything that we missed?
Thank you. Thank you.
Is there anything we missed that you might think that it's important for our listeners to know about the incredibly, I want to say life-saving work that you do on a daily basis?
It is life-saving.
Mhm. But just notice, like I said, this is your calling, your passion. Always do a check evaluation to know, is this what you're called to do, and did you make a change on today?
That's
If you
awesome.
didn't feel that, then go back and say, how can I make a change to make that difference? What can we do different to make it better? So just make sure you ask yourself that, ask that question every day in the morning, at night. Did I do a difference? Did I make a change in somebody's life? And if I didn't, or I felt I needed a little bit further to push myself a little bit more, I push myself a little bit more. I think I'm a little bit hard on myself a little bit, but yeah, I try to just keep that going, to always ask those questions that I make a difference.
Oh, well, Tina, thank you so much for being with us today. You've been a wonderful guest, obviously, no surprise. And I'm
Thank you.
so grateful for your care and friendship. Really happened at a difficult time in our family's life.
Mhm.
Please know the work you do, the service that you provide are life-saving, sanity-saving on many levels.
Yeah.
And thanks for being so kind and wise. You gave my entire family tremendous comfort. So thank you so much.
And I will add to that,
Thank
Tina,
you.
that
Thank you for having me.
I feel as if I know you, and I've just met you now because the things that Dr. Mazza said about you, about your helpfulness, your spirit, your calm, your wisdom. So please know that those questions you're asking yourself every day, I think you're answering them just right.
Oh, yeah.
Thank you. Thank you. Appreciate it.
Listeners, please do your own research from reputable sources. Stay on top of local news and ratings you can find online. Stay connected. Ask trusted doctors, friends, and family too for recommendations. caring.
Hospital staff too.
Hospital staff. You know, you can contact senior services organizations, your area, for recommendations and more information. There are lots of options, and we've just scratched the surface and kind of given you an insight into the world of home health aid, which I think Tina is an awesome example.
Oh my gosh.
She really,
I'm in awe of her.
yeah.
I'm moving wherever it is, wherever she is. Gotta go.
So I wanted to create this podcast to provide life-saving education and to encourage folks to see a doctor in time to prevent or minimize damage. That's deeply fulfilling. I enjoy helping folks understand how all aspects of their lives are tied to both thyroid and overall health. As always, my goal is to help us live more fulfilling lives by taking control of our health and thus feel our best. In fact, that's why I went into endocrinology. It's a medical art that combines science with the study of our lives and all that they encompass. And even though we didn't really talk a lot about thyroid today, I really think that this is going to go nicely into our next couple of episodes, which kind of include longevity. And
it does.
all
Yeah.
I mean,
because it's longevity, and she's dealing
Yeah,
with
and-
some people that have
Yeah.
had tremendous longevity.
Yeah, and we're going to talk about health span versus lifespan, all that good stuff. But our next episode, number 34, will be part 1 of a 2-part series on longevity. Part 1 will focus on the blue zones, areas where people can live up to 100 years or more, centenarians and super centenarians.
That's right.
Part 2, episode 35, will also be about longevity, but more on the cellular level.
That's right. And yes, it does tie in. And I think also you mentioned cortisol, and this is health, and it's all tied to the thyroid. It all
Right.
comes back to the
I know.
thyroid. It always does. As always, we hope our listeners will continue listening to Thyroid Talk with Dr. Angela Mazza. We have many more interesting episodes and guests planned. We'll build on today's foundation and cover many topics we hope you'll find meaningful. So now, to recap just some of what we covered in this episode with Tina, who is just remarkable, and not necessarily in this order, we talked about what services may be available, the importance of respite care, finding help and asking for it.
Yes.
That
It's okay
second
to ask
part,
for help.
yeah, it's more than okay.
It's okay.
It's required. It's really necessary.
Especially considering the stress of being.
Oh my golly. And again, just 1 week has opened my eyes to many a thing. So finding help and asking for it, please, please, please consider doing that. The potential benefits of in-home care services, what types of patients, for example, that Tina has seen, why families and patients may resist seeking assistance.
Again, back to it's okay to ask for help.
Oh, please. Again, I repeat it. It's more than okay. I think it's going to, as you said, life-saving, sanity-saving. Many of us are not used to asking for help,
Right.
especially in our homes.
Especially in our
Just have to jump that hurdle. Mistakes that we may make in thinking about this issue, things we may not have realized. She certainly was very eye-opening. And how hard it may be to care for a patient emotionally and physically in a home or anywhere else without assistance. Best of all, I think we learned that in-home healthcare, and not necessarily just in the home, but healthcare assistance can sure impact our lives and the lives of those we love. Dr. Mazza's book, Thyroid Talk, An Integrative Guide to Optimal Thyroid Health, available on Amazon. There is an online master course related to the book to help guide us to optimal thyroid health. It's entirely online, live, but also recorded for future reference. Participants can share their questions and concerns if they want to. That's optional, and get customized information on how to work toward healing. The customized part is the best.
And the online course helps us walk the talk to energize our lives. We are relaunching, and we'll be having more different setup, more of a Netflix setup for webinars. So stay tuned for more information on that. It's looking towards the end of the year and early next year.
Oh, I'm glad you told me that. Did
Pretty
not.
cool.
We haven't had any chance to talk.
I know.
Recently. So, yeah, be just crazy busy. For more information, you can check thrivethyroid.com. or forward your name and email to thyroidtalk.mazza@gmail.com. You can also contact Dr. Mazza's website, metaboliccenterforwellness.com.
Like I mentioned, the initial webinar is going to coordinate with the online masterclass. And the masterclass has cool modules that cover topics like diagnosis of thyroid issues, personalized treatment, gut healing, and much more. Brain fog, hair loss, thyroid nodules. You know,
Gut healing. I'll just mention it
please get
again.
gut healing. And for more information on at least some of the supplements we may discuss on the show, please visit the wellness store at metaboliccenterforwellness.com. Full disclosure, I personally use and I carry supplements by Douglas Laboratory and Pure Encapsulations in both my office and at our online site. Please stay in touch. Check out my YouTube channel. We got more than 110,000 subscribers now.
Wow, that's amazing. Good for you.
The website at metaboliccenterforwellness.com, as well as Facebook and Instagram.
That's a big number. You're doing good.
Thank you.
Well, listeners, we welcome your input. As always, please submit your questions, comments, and show ideas to thyroidtalk.mazza@gmail.com. That's an email address. We may disclose your general location on air, the city or town, for example. We will not read your name nor your address on the show. We reserve the right to edit your input as necessary. And finally, don't forget to ask your healthcare provider any specific questions regarding your wellness. This podcast is meant for educational purposes only.